So in December of 2014, a bill was passed unanimously in the Parliament, a private member's bill brought forth by Elizabeth May, who's been a passionate ally in the fight for appropriate Lyme disease recognition in Canada for many, many years. She had heard stories of a complete devastation, lives being torn apart, life savings being taken in order to get diagnosed and treated for this illness that is just not being treated with the respect that it deserves in Canada. We know that in recent decades, and specifically in the last 10 years, we've missed a lot of cases of Lyme disease, and people have become chronically ill with the illness, and it's created not only a personal burden on people and their families, but also a financial burden on the system, especially the medical system, when people are trying to find diagnoses here and there, seeing specialists and not getting the answers that they're hoping for, or that give them an idea of what the root cause of their problems are. And so this federal framework moving forward is very important because we know that Lyme disease is a growing issue. It's been present in Canada for decades, but at this point, because of climate change, we know that it's only going to become a bigger issue. We hear estimates of 10,000 official cases in just a few years, and so this is a serious issue. So we want to make sure as much as possible that anybody who gets infected starting tomorrow, as much as possible, would get appropriate, not only diagnoses with appropriate either clinical evaluation or testing that is better than what we have now, which is completely inadequate, and that the person gets appropriate treatment, not only in a restrictive protocol that we have now, but treatment until they are better.